Welcome to the Alcohol Free Life podcast, brought to you by thesoberclub.com. I'm Janey Grace. This is for you if you've quit the booze or you'd like to, or maybe you're just sober curious. I'll bring you tips and motivation without any judgment, and there'll be inspiration from experts, quit-lit authors, and sober heroes. Hi, and welcome to the podcast. I hope you're well. We've had a bit of sunshine this week, haven't we? So grateful. I mean, I know it's been freezing and everything, but just to see a bit of winter sun completely lifts your spirits. So I had a fabulous weekend. Last weekend, I got to do some training in Reiki and energy healings. Absolutely amazing. Really enjoyed that. It'll be interesting to see how that gets incorporated into, various things that I do. And it's been a really nice week in the Sober Club. We've had some lovely sort of triumphs, some people just saying so much lovely stuff. If you are a member of the Sober Club, thank you so much for being part of our gang. It's so appreciated. And for those of you who aren't, then think about joining us. The price has to rise a bit for new members. So if you've been thinking, maybe I'll join, then now would be a fantastic time. It's amazing value. Of course, I would say that, wouldn't I? And it doesn't matter if you're sober curious, maybe you're thinking about it, or maybe you've been sober for years. It's all about the what's next, the well-being, the forward thinking, the connection. It's all of that stuff. So it's been a really nice week in people kind of contributing and sharing how they feel in everything that's going on in their life. Also, it's a very good time to join because from next week, we're going to have a rerun of our self-love challenge. And don't get too worried. Doesn't mean you don't have to do very much. You just have to kind of set an intention that you'll open up the emails. And if you can commit 15 minutes a day, that's what I'm asking, 15 minutes a day, then have really quite powerful results at the end of that. But if you can only do 7 or 5, well, that's better than nothing. So we did this before and we had a really good response. So that starts next week. So if you're thinking about joining us, then just pop along to thesoberclub.com and join us there. You can join for a month, and if you hate it, just leave. It's the cost of a coffee and maybe a biscuit with it every week. So it's nothing really. Anyways, it has been one heck of a week in the press for stuff around alcohol, and some of you may have seen the posts I did on Instagram. Please follow me if you don't already, at Janey Lee Grace on Instagram and Facebook. And I did a post there in response to the piece that came out at the beginning of the week across the press with Professor David Lloyd, who the headline was a very catchy headline, "Miracle of the Ozempic for Alcohol. This cheap little known pill works even if you're not a binge drinker. And you can get it on the NHS. So many more should take it." That was the headline. So what they're talking about is the drug naltrexone, which I'm sure many people are aware of. It's been around obviously for many years, and if I'm not mistaken, I'm not an expert on it obviously, but it works by blocking the brain receptors. So effectively that kind of sense of that pleasurable buzz is dampened. So in other words, you don't get that kind of dopamine hit that you might think you get from alcohol and the production of those kind of chemicals, the urge to reach for the drink. So the thesis of this piece is that many people are drinking more than they want to, absolutely right there. And drink way more than the recommended units a week. Although, of course, I would say it should be recommending 0. At the moment, the way these drugs are given out are just for people who are effectively, needing treatment. But this piece is arguing that, pretty much anyone who's drinking more than they want to should be given these. Should be given this drug. Well, you can probably imagine, you can probably guess, I don't agree. I absolutely don't agree. I totally get that medication has its place. I get that completely. I recognize that, some people need support in different ways to beat where they're at. But my feeling is what we need to be talking about here is that the answer is not, well, okay, let's combat the first drug with another drug that might dull the urge of the first drug so that it's not quite doing everything you thought it would. It's a bonkers idea. I'm sorry, but it's absolutely bonkers. It's creating another potential addiction or dependence, at least. What we need to do is recognize that quitting alcohol is not about deprivation. It's not about what you're going to be missing out on. It's about freedom. And, we know, don't we, when you quit alcohol, it's not just that you don't feel so bad. You feel good. You get the energy, the confidence, the clarity, the self-respect back. You start to like yourself. You stop needing a substance, any substance, to be able to function okay, to be able to relax, to be able to deal with stress, because you're building that life that you do not have to escape from. And that's got to be surely what we want to focus on, rather than, oh, can I stop another pill to stop me craving it? How about not crave it? How about recognize that it's nonsense, that you've been lied to all these years? Of course, I'm pointing one finger back at myself here because, I don't know, 8 years ago, I'd have probably thought this was a great idea. But now I hate it. It's relying on something else that will send the message that you still need something, that the answer is not within you. You need something to control your drinking. But actually, if you're not at rock bottom, you can actually make that choice. You can look at alcohol for what it is. You can get a grip on that. The logic is really key. And you don't need a drug to block the pleasure that you would get from drinking. You need to recognize that pleasure was never from the drinking. It's just an illusion. Alcohol doesn't give you a pleasure. It's the associations around it. They do reckon, don't they, that the dopamine hit that you get kicks in a few seconds before you actually sip the drink. It's not about the alcohol. It's about the associations. If you were to get the alcohol in a nasty paper cup and it's warm and a little bit, old, and you're standing, near a skip in a dark alleyway, well, that's the dopamine's not going to kick in then, is it? Even if you're still having the alcohol, because it's not about the alcohol. It's about the associations. So for me, rather than trading one dependence for another, let's just inspire people that life is so much better without. Preaching to the converted, aren't I? A lot of you get this already. So anyways, I did a little Substack post on this if you want to read. I'd love to challenge David Lloyd. If you happen to be listening, Professor David Lloyd, come on the podcast. Let's thrash it out. I'd love to chat through this with you. And then the next piece that came out the next day was really sad. It was across all the press, different headlines, but the same story really, which is that the death directly attributed from alcohol hit a record high, despite, they say, less people drinking, or there are fewer people aged 25 to 59 who are drinking, apparently. But the deaths for alcohol, related stuff is off the scale. It's risen ridiculously. I beg your pardon. It's not the stats for drinking. It's the stats with the 25 to 59 age group. The article said the number of deaths among 25 to 59-year-olds declined since 2020. But for everyone outside of that age group, it was 4.2% higher than the 10,148 in 2022, and up 30% since 2019. Now, I mean, that's a rise. That's a hell of a rise. And it seems incredible, because why is that still happening? Why have we still got that many deaths from alcohol, from alcohol? Why? It's crazy. We've got so much more awareness now. We've got more alcohol-free drinks that can be chosen. We've got, there's so much more going on, but something's going wrong, isn't it? Because for people who are really in that dangerous ground, they're not being given, the support they need early enough. There's not enough awareness being raised, it seems to me. But anyway, Professor Ian Gilmore, chairman of the Alcohol Health Alliance Foundation, said the main causes of the rise were cheap, easily accessible alcohol and aggressive marketing, and called on the government to prioritise tackling the crisis to prevent long-term sickness. Well, yeah, hallelujah to that. So I thought it might be an idea this week, because this is on a lot of people's minds. This article is being printed and reprinted everywhere. And so I thought I would rerun my interview that I did with Sir Ian Gilmore. It was for a little while ago. So, of course, a few things may have changed. But from this piece this week, I suspect not much. So I thought I'd give you a chance to hear that again. If you have heard it before, then you might find it interesting in the light of this new study. And obviously, if you haven't, I think you'll find it an interesting interview with Sir Ian Gilmore. Just before we get into that, on a much happier note, I would love to remind you that we have Family Constellations on February the 23rd, Sunday, February the 23rd. It can be life-changing. It's just a fantastic day. So if you're open to that, check it out. There are a few spaces left. It's in Hertfordshire. Go to thesoberclub.com, click on events. That's Sunday, 23rd of Feb. And a few days before that, for those people who are interested, and I totally get this is not everyone, but in case you have ditched the booze and you're now thinking, I'd really love to think about a different purpose, doing something different, inspiring other people, then on February the 18th in the evening, and we've got a free webinar, Exploring a Career as a Sober Coach. It's completely non-salesy. I ain't trying to sell you nothing. I'm just going to share some thoughts and some ideas around what, your purpose. You want to think about your purpose moving forward, and just how rewarding it is actually to be able to inspire other people. So it really is amazing. And I'm sure lots of you are doing that now. It is incredible how once you quit alcohol, you just get this kind of aura, and people do come up to you, don't they? And, in the workplace, like, oh, by the way, I know I made fun of you the other day at that event, but actually I'm really interested. How did you quit the booze? So, join us for that webinar if that's of interest to you. Again, it's under thesoberclub.com/events. And then for those of you who want to treat yourself, March 7th to the 9th, I've got a very special retreat, Soulful, Sobriety in Essex. You don't have to be sober. You can come, whatever your state, whatever your situation, doesn't matter at all. But we'll be focusing, of course, on just how joyful a life without the booze is. And it's for everyone. We'll be having all kinds of amazing stuff there. So maybe it will open your experience to new stuff. We'll be doing a cacao ceremony for sure. We'll have a sound bath. We'll have workshops. We'll look at how you can release limiting beliefs. There's a whole bunch of things we'll be doing. Fabulous food, gorgeous surroundings, really, really fantastic bit of nurturing for you if you can invest in that. 7th to the 9th of March in Essex. A few days after that, I'm hoping we'll be having another live podcast recording. So it'd be amazing if you can come to that. That will be in London. I'll confirm that date as soon as I have it. It's probably the 18th of March, but I need to confirm that. So keep checking on events, and you'll find that information there. So what I wanted to share with you this week is a recording that I did a little while ago with Professor Sir Ian Gilmore. So this came about because I did an interview with Susan from the Sober Code. I'm sure some of you will remember that interview. She had such a fascinating story. And Susan is very actively involved with the Alcohol Health Alliance. And she knows, a lot of we've had lots of discussions about the Sober Coach training that I offer. And as I'm sure many of you know, I work with coaches who are going to be working with people who are grey area drinkers. So as you know, that term relates to people who are drinking more than they want to. They're somewhere on that spectrum, but we don't work with those who are alcohol dependent. And one of the conversations I had with Susan was, one of my greatest kind of frustrations is that as sober coaches, we are very clear on who we work with and sure that, we've got all our kind of risk assessments and ethics in place, and we work with people who are functioning, who are grey area drinkers. We don't work with people who are clinically dependent. That isn't our remit. But if only we had some, kind of unified, if you like, at least UK-wide resources to be able to signpost those people too. How amazing would that be? But in my experience, there are some pockets of support across the UK, but it certainly isn't unified. It certainly isn't obvious as to where you can send those people for help, other than obviously the GP as the first step. So I'm just pitching that out there in case you have amazing stuff going on in your area that you know about. Please let me know, because at some point it would be great to be able to gather more of a list of support of what might be available. But someone who is working on all of this at government level is Sir Ian Gilmore, and Susan introduced me to Ian. He's works with the University of Liverpool. Is the chair of the Alcohol Health Alliance UK, and really at those kind of top government levels, he's really getting his hands dirty in all of this stuff. And I think there are very few people who are. So I was very grateful that he was willing to take the time to chat to us on the podcast. I'm so pleased that my guest is Ian Gilmore, who is the chair of the Alcohol Health Alliance. Professor Sir Ian Gilmore, I should say. Welcome. Thank you so much for joining us.
Not at all. My pleasure.
It's great to be able to chat to you, because I was interested to introduce to your work by Susan Laurie, who is doing some amazing stuff in this arena. And it's not an area that we talk about a lot on this podcast, because fortunately, many people listening to this podcast, they're in a position where they have dealt with stuff before it got too bad. And for that personally, I'm incredibly grateful that I didn't wait until I got to rock bottom, as it were. But I'd love to know a bit about the work that you do. Could you just tell me a bit about your background and what kind of got you into this work?
Okay, well, in a way, it's the exact opposite to what you've just said. I've tended to see people who've got into problems without really realizing it, because I'm a gastroenterologist by background, and my particular interest has been liver disease.
Right.
And something like 70% of liver disease deaths are from alcohol-related liver disease.
Are they really? Wow.
Cirrhosis caused by alcohol. Now, there are 30% of other causes of cirrhosis, but in fact, that's a big problem, because if somebody says they've got cirrhosis, people assume it's related to alcohol, whereas 3 out of 10 of them have probably got cirrhosis from another quite unrelated cause. But anyway, to use the public health analogy, I spent my professional career pulling drowning people out of the river without ever thinking of walking upstream to see why they were falling in, and finding a rickety bridge that one could repair and stop people falling in. So I became, as well as it were, treating advanced cirrhosis related to alcohol, I got interested in how do we stop it happening in the first place.
Yeah.
So my background is clinical, but not addiction. I'm not a psychiatrist. I did once do a degree in psychology many, many years ago, but my interest has been in clinical medicine, ill patients with physical illnesses, the physical consequences of alcohol. But when I was president of the Royal College of Physicians in the mid-2000s for 4 years, for the first time in my life, someone other than my mother listened to what I said, and I had a chance to do something. And I set up the Alcohol Health Alliance, which is really what it says on the tin. It's a loose alliance. We're not a legal entity, but we have more than 60 organizations that have as one of their priorities trying to reduce the harm from alcohol, both the physical and mental harm. We get together and share our priorities. We produce reports. Our two main areas are, firstly, prevention, how to particularly get government to adopt evidence-based policies that will stop people falling into that proverbial river, but also trying to improve treatment services, because access to treatment services is appallingly poor in this country, and much poorer access, for example, than people with drug-related problems. So one of our priorities is to improve that access to treatment for people that are aware they're falling into difficulties. An innovation that I think perhaps one of the few successes over the last couple of decades has been alcohol care teams in hospitals. Now, virtually every general acute hospital will have an alcohol care team with a consultant in charge, and perhaps some specially trained nurses so that if someone who comes in, having fallen over and broken a leg, but have clearly got an alcohol problem, they're referred to the alcohol care team, and they're expert at kind of trying to plan the next steps for the patient. And that's been a great success, I think, within hospitals, but there's still a huge gap between being in the hospital and then going home again. And then so many patients fall through the cracks, as it were, between inpatient care and going home. And that's an area that really needs urgent care. I think I'm probably talking too much.
No, not at all. No, it's really interesting. I mean, I'd love to pick up on a few of the things you mentioned there. Firstly, you said that there's more available for people who have issues with drugs. Of course, alcohol is a drug, isn't it? It's just that it's legal. Right. It's just that it's legal, isn't it? So, and this is where one of the biggest problems lie is that, we say drugs and alcohol. Of course, it is. Absolutely. It is a harmful drug.
You pick me up on something I pick up other people on.
I know. But
I try and talk about alcohol,
we all do it.
Alcohol and other drugs is what
I know.
we should say. But
this is one of the key issues, isn't it? Because it's legal, because we all do it, or a huge percentage of people do it, because many people in the medical profession drink, because a lot of the surveys and the studies that we read come from alcohol companies who are involved in the marketing. I don't know your opinion on that, but this is one of the issues. How do we start with that? How do we get people to recognize this is a harmful drug?
Yes, it's our favorite drug, and as a nation, and it goes back thousands of years, and we are, the aim of the Alcohol Health Alliance is not to make the whole country abstinent. We're not a temperance movement, but we want to see the harm from alcohol eliminated. Now, it's not practical to believe it's going to go away completely, but we think it can be minimized.
Yes. Yes.
And although at one level there's no safe amount of alcohol, and any alcohol will increase your risk, for example, of some cancers. But there's a difference between population risk and individual risk.
Yeah.
You'll be familiar with the chief medical officer's recommended upper limits of consumption of about 14 units a week. Well, 14 units a week equates roughly to having a 1 in 100 chance of dying of an alcohol-related cause. And, if your risk of going out on the road are 1 in 100, you'd feel a bit unhappy about it. But on the other hand, other people might think 1 in 100 is not a bad risk, but at least it gives you some idea of what the risks are. Now, if we could shift the whole population consumption down, if everybody in the country started drinking 5 units a week less, we would save probably thousands of lives.
Yeah, absolutely.
If one person reduced their alcohol consumption from 18 units to 13 units a week, they'd reduce their risk of dying from an alcohol-related cause from 1 in 80 to 1 in 120. So, which is still 1 in 80 is still pretty good odds. So, the individuals who are at real harm are those who are drinking much more heavily than that.
Yeah.
But in terms of population harm, stress on the National Health Service, etc., then getting everyone to drink less, even those who are not drinking very heavily at the moment, would bring its benefits.
And have you seen a big change I did see a study recently that said that, I think it was 2019, there was an NHS study that said it was something like over 60% of people were drinking 14 units a week or more, and now it's come down to, I forget the percentage, but something like 10 units a week. There have been
some changes. The problem is that most studies on alcohol use patient-reported consumption, and we know.
Of course, we lie, don't we? Of course we do.
We lie. I mean, the old adage that the doctor doubles what the patient tells them
exactly
is probably just about right.
About right, yeah, exactly.
And it isn't always willful lying. It's, when people forget the special occasion,
of course,
the Christmas and it's thought that the average person over a fortnight's annual holiday in Spain or whatever will drink the equivalent of several months in the rest of the year, and that doesn't come out in the doctor's history. So the data are not very reliable. Probably more reliable are data that come from alcohol sales and duty payments. But then, of course, that's confused by tourists coming in and other people doing the drinking, etc. But overall, there's been no measurable fall in consumption. If anything, it's possibly rising. There was some interesting data over COVID. Over COVID, it seemed those who drank small amounts moderately tended to reduce their consumption during lockdown, whereas those who were already heavy drinkers tended to increase their consumption.
Yeah, that
they
makes
were
sense.
More susceptible to stress or whatever. But of course, we saw harm go up because those at greatest risk of harm are those who are drinking more. And so it was almost like a group of people who were already on the edge of the cliff.
Yeah, exactly.
Don't
get me started on that, Sir Ian, because I would not have been in favour of leaving off licences open when gyms were closed. But that's another topic, isn't it?
No, you could get me talking on that for a long time. And I give lectures on the impact of COVID on alcohol consumption.
I bet.
But what is interesting is that younger people are genuinely drinking less.
I know, isn't that great?
And the group that are really worrying at the moment are the older people who are perhaps have more disposable income. Not paying off mortgages, and not only are they drinking more, but they're also at greater risk because they're the ones who got high blood pressure and heart disease and so on. And those are the ones who are at risk of falling down the stairs and having a head injury on their way up to bed at night. Yeah, absolutely. So
I'm getting the sense that the work you're doing is obviously really important because the aim is to let's catch this earlier, effectively. Let's catch the whole thing earlier before the horse is bolted, Absolutely. As it were, before they're in the river, as you say. Now, I don't know your view on this, and I know you work within the NHS, so it's possibly not something you can comment on. But for me personally, one of the biggest frustrations is that there seems to be very little awareness within the front face, your GPs, your consult, people you see at the beginning of whatever you've got going on. There seems to be very little awareness of the impact on your drinking on whatever else you have going on. So what I mean by that is I have lots of one-to-one clients who come to me for coaching, and they'll say, I'll ask them, for example, are you on antidepressants? And they'll say, yes. After my divorce, they nearly always say, I'm not clinically depressed, but after my divorce, I was not in a great place. So I was put on antidepressants. And then I'll ask, were you asked about your drinking? Absolutely not. So these people are on antidepressants and they're downing sometimes a bottle of wine a night. In addition to that, many of them are also on HRT. So again, and nobody I know has ever been asked. I mean, how bizarre is that? They're not even asked. If they were asked and the answer was, well, yeah, I do drink, I have a couple of glasses of wine a night, as you say, double it, what they'll be told, and I know from personal experience, what they'll be told in almost every case is, oh, well, just you seem fine, but just have the odd alcohol-free day.
Yes, I'm not proud of our success in the NHS in asking patients about alcohol consumption. I know that GPs are incredibly busy. Junior doctors, again, rushing from pillar to post, and awareness should be higher. I wrote a paper in 1977 saying that junior doctors were not taking alcohol histories, and I don't think we've improved an awful lot since then. I think hospitals have improved a bit, and I think these alcohol care teams that I spoke about, I think, have helped to increase awareness. But I do think we need to do an awful lot more to tackle the stigma against alcohol, people with alcohol problems. That they're often seen in A&E departments as revolving door patients. Oh, there's blogs back again. But of course, the staff don't see the ones that don't come back. And I think one of the key messages is that even people who are, have reached the bottom of the spiral that you referred to, I think some of those do turn the corner and come back. And it's very satisfying to look after those patients who do. So I think there is work to do in the NHS, and the NHS is not in a good place in general at the moment to try and preach the prevention strategies. And governments have, we've not had an alcohol strategy for 10 years. And
governments is another one, isn't it? It's very difficult. If you can't lead in any way by example, it's really tough. I mean, some of the messaging that has been coming out recently, we can't deny it. It's absolute nonsense. Some of the stuff they come out with about their Friday wine parties or whatever, it's actually not funny.
No,
I know they're trying to be funny, but it's actually not funny.
And I think the problem with governments is that they're, it's a 5-year term. And so anything that's going to take more than 5 years to kick in, which prevention is usually a fairly long-term strategy, they're just not interested in. And as you've mentioned, the power of the drinks industry is just phenomenal in if you try and put duty up 5p or something on a pint of beer, you'll be told straight away that there'll be thousands of people unemployed as a result, and the treasury will go broke, which of course is the opposite. Alcohol costs the country more than it brings in revenue and jobs.
That's it. Oh, what you mean because of the harms?
Yes.
The NHS. Yeah, I see what you're saying. Yeah, absolutely.
And of course, the NHS harms also are the most severe and the most noticeable, but the other sorts of hidden social harms and loss of employment and all sorts of other things, crime and disorder.
Yeah.
I read somewhere, and I've no reason to disbelieve that 40% of ambulance time is taken up by alcohol-related problems.
Wow.
That's just staggering.
That really is. So, I know this is a massive question, but if you could wave a magic wand, or at least a magic wand wave based in some kind of reality, what would you like to see happen? What's realistic that you would like to see happen?
Well, I think we can learn a lot from cigarettes.
Yes.
Admittedly, the end game was different. The end game is to eliminate tobacco completely from society, because it has no redeeming features at all. But the thing that's changed smoking habits more than anything else has been putting up the price. It's gone up hugely.
Well, and also stopping people smoking in public places has made a difference, hasn't it?
That's certainly helpful too. So I would tackle the price. It's much cheaper in real terms than it was 20, 30 years ago. It's probably about a third of the price in real terms than it was 20 or 30 years ago. We've been turned into a home drinking nation by cheap supermarket alcohol.
Yeah.
It may be slightly more expensive, slightly cheaper rather in real terms in bars and restaurants, but it's almost pocket money prices in supermarkets. And of course, the biggest offender are things like white cider, where you can get, more than your
units,
40 units a week in one bottle of
that's unbelievable, isn't it?
Cider. And that's something that minimum unit price has hit in Scotland. It's virtually eliminated that white cider. So I would look at duty and minimum unit price. They work together. They're complementary. I would work on some quick gains where everyone is behind us. The drink driving limit. There are 2 countries in Europe that have a limit of 80. That's us and Malta.
Yeah, that's crazy, isn't it?
The rest of Europe is 50.
I mean, aren't I right in thinking that even in Scotland you can't have one drink?
It's in Scotland. It's 50.
Okay. So that's practically not a drink, is it?
We're 80. We should be coming down probably to 20, which allows for a little, a strong aftershave or something, setting off the breathalyzer. But otherwise, it's in effect not drinking. Another quick win that I think everyone agrees with is having proper labelling. There's more information on a bottle of milk than there is on a bottle of wine.
Yeah, it's crazy, isn't it?
So those are quick wins. I think improving early detection of people who are beginning to run into trouble without realising it, and offering them help that's not stigmatised. I think there's a real problem if you put alcohol and drug treatment services physically together, because I think people still see themselves as being different from a crack cocaine user or a heroin addict.
Absolutely, I agree.
We certainly need to improve our treatment services. I think we need to get the message out there that it's not just a matter of free choice of the individual. Firstly, nobody asks to be alcohol dependent and to get cirrhosis of the liver or brain damage from alcohol or whatever. It's not a choice. Alcohol dependence is a disease. It's probably 50% genetic, and then there's the environment with the advertising and go on, have a drink being thrown at people, every day. So I think we need to try and destigmatize people with problems. We need to look at the roots of the problems, which are the price, the marketing, and the availability. What sense does it make that you can buy a bottle of whiskey at 2:00 in the morning at a petrol station?
Yeah, exactly.
So those are the 3 big evidence-based things: price, availability, and marketing. But then we also want to do things like inform the public better. There's no government-funded, public health messaging going on.
No, exactly.
There is Drink Aware, which is funded by the drinks industry, and there are many publications drawing serious concern to Drink Aware. I know a lot of people who work in the organisation do it for the best of motives, but they are virtually completely funded by the drinks industry, and that isn't.
No, absolutely.
That isn't independent advice. So we need to get much better information out there. And we need to draw attention to the fact that it isn't just the drinker. It's not just their choice, but it's the harm to others, through from the unborn baby, through to the children of dependent parents, through to the victims of domestic violence, and the list is endless. And although secondhand smoke probably does cause some harm, it's nothing like the magnitude of the harm. The secondary harm, as it were, from alcohol. Yeah,
absolutely. I mean, one thing you picked up on there, talking about people being able to get support earlier, and you're right. The stigma has to go as well, because I know I've had one client that I was talking to had gone to her GP to express her concern. She was drinking. Things were definitely ramping up. She could sense that she was not in a good place. But the very first thing that seemingly had to happen was her employer had to be contacted. Now, that's going to be the deciding factor, right? I wish I'd not said anything, and maybe it's better not, she'll now be telling anyone else who's in the same boat, do not go to your GP, because they'll tell your employer. So then you'll potentially lose your job. Your kids might be taken from you. It's like, please, this is the fear people have. I'm very surprised by that. I think if a GP thinks someone is drink driving, for example, yeah, of course,
then
that's
they would have an obligation. But then otherwise, I wouldn't.
It's not always the case.
No, certainly not.
Well, that's good. That's good to hear. That's good to hear. I mean, obviously, I agree with everything you're saying. That if we can put those things in place, wouldn't it be great if we can actually get some prevention in before everything gets too far down the line. I think something absolutely has to be done about this, about the fact that the alcohol industry controls so much. That surely something can be done about their marketing, because it's everywhere. You can't buy a birthday card for a young man that doesn't contain pictures of booze. I mean, there's not every single thing, and it's all about the glamour of. It's actually completely, all of it is BS. The glamour about. They never show you, funnily enough, what happens after their clients have consumed their products, because that's not quite so glamorous and elegant, is it?
I mean, in some ways, I don't blame the drinks industry, because their first obligation is to their shareholders. Of
course, they're selling their products.
I blame government for
exactly, for allowing it.
I've wasted years of my life on voluntary partnerships between government and industry, where industry agree to do all sorts of things and then drag their feet for years, and nothing happens. I often think if I turned right rather than left out of the school gates, I might have ended up working for Diageo. And if so, I would have, you can't do something without developing a belief in it. And I think if you sell Persil washing powder, you end up believing it washes whiter. Otherwise, you'd go mad. And so I think people in the drinks industry will look for the evidence that is more in favour rather than against.
Yeah, true. Well, I think all we can do then perhaps is meet where we touch and counter that with as much information as we can and awareness as we can as to the benefits of choosing not to drink.
Yeah.
Right. How about we talk more about that? Because
absolutely,
the
benefits of not drinking. So many people tell me, that they sleep better, their skin is better, their energy is better.
Their mental health and well-being is, the changes just can't be overestimated. It really can't. And, the link between mental health and anxiety and alcohol use, you cannot deny that. It's, it really is massive, but we don't talk about the benefits. Well, I do, but it's not talked about enough.
Get people to write to their MPs, go and see their MPs.
All right. Is that worth doing? Yeah.
Absolutely.
Okay. Well, I'll get mine off straight away.
One thing an MP wants is to be re-elected, and
great.
This present government have woefully failed to bring in any evidence-based policies.
Right. Okay.
Reduce the harm.
Okay. Well, that's really helpful. I think we can all do that. It's great to chat to you, Sir Ian. I really appreciate it. Thank you so much for the work that you are doing. I mean, we really need people fighting this corner, don't we, at the top level? So it's much appreciated.
Well, we need people doing what you're doing as well.
Yeah, I guess. Thank you so much. I really appreciate your time.
Bye-bye.
Thank you, Ian, and for the work you're doing. It is great that we've got some advocates, but you've heard me say before, I don't hold out a tremendous amount of hope for things changing. When you see the amount of revenue that alcohol brings in the UK, somehow I just don't see it changing anytime soon, really. So it's very sad, isn't it? But, the more of us that can just raise awareness and shine that light on life being better without, then that's how the message might start to hit home. So join us in the Sober Club if you'd like connection and support and accountability and everything connected to wellbeing, thesoberclub.com. Click on events if you want to check out the stuff we've got coming up, Family Constellations, the webinar on the 18th, in case you're interested in training to be a sober coach, the retreat early March. And anything else that pops up along the way, it would be great to have you with us. Don't forget that power of connection, whether it's online. We had a Sober Club meetup online earlier in the week, and it was just great, even though we weren't in person, just to see each other and recognize that even though we're disparate, we're at disparate parts of the world, different parts of the world, we all have different backgrounds, different stories. There's such an amazing connection in this shared experience. We've really got each other's back. We become literally cheerleaders for each other, and there's such a gift in that, really, such an amazing gift. So if you are early days, if you've only been at this game a few weeks or even a few days, hang on in there. Don't get upset when things feel a bit tough. Just push through, get yourself connection and support, and know that this too shall pass. When that urge comes in, go distract yourself, do something that lifts your spirits. This too shall pass. It really, really will. And stay connected. Follow me on social media at Janey Lee Grace. You can find me wherever. And if you want to reach out, if you want to tell someone you're doing this, you can tell me. It might not be appropriate to tell your boss or even your partner, but tell someone who's been there, done it, got the t-shirt. That's the best way to do this, because that's another layer of accountability. So you're very welcome to reach out. I will reply to any message if I see it. So do reach out. And if you want to support this work, by the way, you can sign up to my Substack. You can support me on Substack, or buy me a coffee. I think it's buymeacoffee.com/Janey Lee Grace if you want to support the work of the podcast. And I'll see you next time. Thank you for listening to the Alcohol Free Life podcast, brought to you by the Sober Club. Please rate and review. And if you want support, accountability and inspiration, and you want to live your best life without the booze, check out thesoberclub.com.